All right, coming to you guys. Good morning. Good morning. Good morning. I have a popular topic coming at you guys today, and I'm really excited to talk about this because, let me just give myself some more light. Even though it's so beautiful out, it's so sunny out, we're going to talk about infertility, and we're going to talk about it probably from a little bit of a non-traditional way that might not be as, maybe you don't have as much knowledge around. Maybe you think I thought IVF and infertility and IUI and all the treatments are just like there's only one way to do it. And today I want to talk with you guys a little bit about some of the things that can happen when women are trying to get pregnant, because it is a popular topic, which makes me so sad to think, why are so many people struggling with this? Why are so many people having issues with getting pregnant? And I want to share with you a couple things that are applicable and can maybe help you to learn about some of these concerns. So what we're going to talk about, we're going to just dive right in, is types of infertility, which some people are like, wait, there's different types? Well, traditionally speaking, let's talk about the kind of classic traditional thought process, which is we are going to give you hormone therapy, ovarian hormone therapy, aka high levels of estrogen, or higher levels of progesterone, or some combination of both. That's kind of the traditional treatment plan, so to speak. And the reason why that is logical and kind of like the first thought is because the ovaries are really important to produce hormones. We need estrogen to build up our uterine lining. There's lots of things, there's lots of hormones that affect basically uterus. So think about ovaries, uterus, and sex hormones. Okay, those are like the main things that get discussed during infertility. What I want to talk to you guys about is, okay, so somebody might say, I don't really want to do the classic injections. I don't really want to use whatever, patches, injecting hormone therapy. Usually it's just looking at giving estrogen or progesterone or combinations or high levels, clomiphene, clomid, estradiol. But something that I see often, and this is so important to talk about, is that is pretty much the extent of fertility treatments. It's pretty much the extent of what happens. It's just looking at ovary. And what can happen, and I see this a lot in my practice because of course I'm looking for stuff like this, is that sometimes you can have infertility that's causing infertility, issues causing infertility because of the adrenal system. Now, this is a little bit non-traditionally talked about, but the adrenal gland is a gland. It's part of the endocrine system, kind of the same system as like the ovaries. And its job is to produce hormones, not sex hormones, although there's a little bit of a sex hormone synthesis as well. But we do need to make something called pregnenolone and DHEA, okay, dihydroepiandrosterone, and cortisol balance. So what we find, there's a lot of things we find, but if the adrenal system is not happy, it can affect the ovaries. So what I'm saying is that adrenal concerns can cause infertility as well. Now, how that looks different is because, like what we just mentioned, is that traditional therapies are only focused usually around ovary, anatomy of the ovary. I'm talking more about the chemical stuff, but of course there are structural things like endometriosis or growths or adenomas or fibroids or obstruction in the tubes. There's a lot of anatomical things that can happen that can cause infertility. I'm not talking about the anatomical things, although sometimes the chemistry affects those types of things. Meaning, if somebody says, I have endometriosis, what can happen is that the endometrial tissue is usually growing under hormone therapy, meaning too much estrogen can cause endometriosis. So that's a different topic. That's more structural. Structural problems are looking at the anatomy, right? Is the anatomy as it should be? Is everything good? Do we have enough egg reserve? Do we have enough ability to actually hold baby, right? Is the uterus good? Is there additional tissue growing? Are there fibroids? Is there adenomyosis? There's all these structural things that can happen. We're not going to really talk about that, although the structural things have hormonal influences as well. Different topic. We can dive into that a different day. But I'm talking today about the chemistry, right? The chemical part of infertility. So we know classically, like we're saying, we'll just keep recapping so it really solidifies ovarian issues, meaning estrogen, testosterone, progesterone, even things like pregnenolone, which often comes from the adrenal gland, are affecting fertility at the level of the ovary. Okay, that's where you produce these things. Now, what I'm kind of commenting on that's a bit different is, what about the adrenal gland? Okay, what about the adrenal system and those hormones? Adrenal issues cause infertility. If you take one thing away from this, I don't want to get too, sometimes I could talk a lot and I don't want to overwhelm you guys, but what I'm saying in a nutshell is, if the hormones of the adrenal gland aren't happy, it can also cause concerns with fertility. Another thing that we look at is thyroid concerns. Having a low thyroid function or hypothyroid, actually any flavor of thyroid concerns. Hashimoto's, autoimmunity can also cause infertility as well. And what can be missed or overlooked that I find is that patients seeking out care for infertility treatment are not really aware fully that there's other factors outside their ovaries and those hormonal issues that can be causing infertility. Even with thyroid, some people say, well, my thyroid's been looked at. My doctor looked at my levels of T3 and T4 and TSH. That doesn't tell us if there's autoimmune flavors of thyroid issues. There's actually separate biomarkers that differentiate Hashimoto's and hypothyroid. So what I'm saying now, to be clear, is that thyroid issues can also cause infertility. Okay, so the thyroid, the adrenals, the ovary, and of course, the pancreas. Having high levels of insulin or higher levels of insulin also affect the receptors that are governing hormones like testosterone, estrogen, and progesterone. So being overweight or having issues at the level of the pancreas will also affect fertility, because it's not just blood sugar, insulin, I'm craving things, I'm looking for food. Those hormones and the surges of high insulin can actually create problems at the level of the ovary. Okay, so those are also other things that we want to look at. Is we want to kind of pull back. I guess if you take one thing away from this video is, let's pull back and see what else is going on. We haven't even talked about, for example, well, of course, anti-Müllerian hormone, which is another classic kind of, what is your egg reserve? Are you making enough eggs? The eggs can only grow if there's enough hormone or shed, so to speak. So that's another thing that's important as well. Okay. Sometimes people will say, well, my doctor says my anti-Müllerian hormone's low, my egg reserve is low. Okay, why? Why is it low? Is there a hormone that's low that's not affecting the ability to feed the thing that we want? Okay, so that's a side effect. So having low hormones often is a side effect of something. We want to know what that looks like. Also, inflammation. I saw something so interesting this morning. I'm in a lot of groups on Facebook around viral load, C19, and issues with viruses. And there was something so crazy that I did not know about that I saw today in the platform or on the forum. Somebody was saying that they lost a bunch of teeth after C19. And then there was a lot of other people commenting on dental issues after C19. And I said, wow, that's so interesting. I'm not up to date on any of the research about C19 and teeth or enamel. And people were asking, like, what's happening? Is it breaking the enamel down, or like what's going on? One of the things that is a proposed mechanism, and this is off topic but on topic, is inflammation. So we do know that C19 is liberating a massive pro-inflammatory mediator storm. Think of C19, and this is not about C19, it's about fertility and infertility, but think of C19 as like it dropped a glitter balloon of a mess everywhere. And all the glitter is all these particles that are inflammatory. Cytokines and different types of prostaglandins and interleukins and tissue necrosis factor alpha and all these pro-inflammatory mediators, interleukins, right? So the point is that, wait a second. people were losing teeth with C19. How is that possible? Well, inflammation, right? That's the kind of connection. I went on PubMed. I was looking to see if there's any research. There's not a ton of research, which makes me think maybe this person didn't have great teeth, or maybe it expedited inflammatory processes that were already there. We don't know, right? We're not sure. But conceptually speaking, is it true that inflammation could also cause infertility? Yes. Okay. Autoimmune issues, high levels of dysregulated patterns. There's a lot of things. Now, surprisingly enough, and I talk to a lot of women about this, and it's a very interesting thing. Some women say, I don't understand. I'm healthy, I eat so clean, I move my body, I work out, I drink the greens, I take my supplements, I have great gut health, I take my probiotic, I'm doing my enzymes, I'm getting sun through my eyes, I'm in nature, I'm connected to source, I'm doing all the things right, and I can't get pregnant. And then it does pose the question as people that don't do that, right? Like that don't eat well, that are eating anti or pro-inflammatory foods, or like anti-nutrient dense foods, how do they, have pregnancy that are healthy? There's things that we don't know, right? There's a lot of things we don't know. So we're not going to dive into well, why not someone else? Focus on yourself, come inward, and look at some of these other factors, because like I said, classically speaking, and I have a couple fertility nurses in the practice, and sometimes we talk about this. I ask questions like, what does care look like for someone that might come through your doors? And a lot of them say it's very cookie cutter. It's very much targeted towards hormone therapy at the level of the ovary, period. That's it. That's all that's happening. There's nothing else happening. So what we start to do is maybe pull back, broad spectrum, and look at thyroid issues, look at adrenal issues, look at blood sugar issues, and look at inflammatory issues. And start with those things, because those are in the research that can also drive concerns. Okay. And then of course there's energy things that happen. I do think that sometimes people energetically might not be as aligned as they think. And that could sometimes energetically, they're a little bit of a mismatch. Like I remember once I had a couple, the husband and the wife were both in the office, and we were talking about their journey. They were sharing with me all the doctors that they've went to, thousands of dollars later with treatments. And I said, let's dive a little bit more into, okay, we have your chemistry, we have your blood work. When I asked them a question, it was so wild. And you see this a lot with couples. One says something, the other says something completely different. Like same question, one says yes, one says no. And then they both look at each other and are like, wait, maybe there's more to explore there. So energetically, that could be also something that is maybe subconscious or blocking some things. It might not be anything structural. It might not be anything anatomical. It might not be anything hormonal. But it could be energetic, which is kind of a different topic. But let's circle back to the topic that we are on, which is these concerns. Now, another last little random thing that's probably the least talked about, even for me, with some of my patients, but is also very applicable, is pituitary issues. A lot of people are like, what is a pituitary issue? So in your brain, you have a circuit breaker. You have a master command center, the hypothalamus and the pituitary gland. Now, the pituitary gland has a couple different parts, the anterior, posterior, and they create a lot of times the signal hormones that tell the neck down structures to do something. So for example, in my brain, my hypothalamus, my pituitary gland is going to create hormones that will send a signal to my thyroid or to my adrenal or to my ovary to tell it to do something. It's like the parent, right? The parent tells the kid to do something. A lot of times what can also happen is that if you're just looking neck down at the thyroid, at the adrenals, at the ovaries, what can happen is that the master command center gets overlooked. And so that's another thing that can happen is inflammation does not just stay neck down. I don't know why we have this notion that inflammation only happens like neck down. Like in my, my shoulders or in my thyroid, we forget like the brain, right? The brain and the structures of the brain and things like, for example, Alzheimer's and dementia. Those are neurocognitive disorders or diseases that happen from lots of different things, but inflammation is a driving factor, a driving force. So we kind of forget that inflammation can happen in the master gland. And there are tests that you can look at, biochemical tests that tell us about the master gland. Okay, so for example, adrenal corticotropic hormone, FSH, right? These are things, follicle stimulating hormone, TRH, thyroid releasing hormone. There's some hormones that get produced in the gland, in the brain, that tell thyroid do something, that tell adrenal do something. And problems could happen there as well. Now, the company that does amazing with products, I love their products, is Standard Process and MediHerb. They make a lot of pituitary support supplements that could be very helpful. Things like Ovax, Pituitropin PMG, hypothalamics. There's a couple things that are really great. And I think it's so important because I love when a company has done the research and they know what problems do people deal with. You know, not a lot of companies even focus on pituitary supplements. There's not a lot of pituitary support in a lot of supplement lines or even enzyme lines. It's very few and far between. But that can also be another thing, that if this master signal system isn't sending the right signal into my ovary, that can cause issues with my ability to create estrogen or progesterone or testosterone or DHT or prolactin, right? Prolactin's another one that comes from the pituitary. There are benign tumors, adenomas, pituitary adenomas that can happen, that can make a mess of things. They're usually structural growths. They're usually benign. They often aren't malignant. Obviously, always consult with your provider, your doctor, if these are things you want to talk about. But you'll find that stuff in blood work. Traditionally speaking, if something in the blood work will make a doctor say, something's not adding up, right? Like a young woman who's anywhere from, 26 to 38, who's trying to get pregnant. These are biomarkers that we want to look for as, where's my pituitary? Where's my thyroid? Where's my adrenal system? What's happening in my pancreas, to make sure what's happening with my inflammation. Nothing else is driving the system, not just the ovary. The point is, classic Western IVF, IUI is structural anatomy and ovary. Done. Conversations over. Other things are the other things that we're talking about, right? The other organs, the other problems, the things that might be more behind the scenes. And I follow a lot of really great doctors on here as well that are naturopathic, holistic, functional, interested in like what else. And I read a post the other day, which I thought was so amazing. I forgot who said this. If you do know who said it, I do want to give them credit, but something along the lines of undiagnosed infertility or unknown infertility is a lazy diagnosis. And I said, yeah, I agree with that. We don't really know. So good luck, try these treatments. Many women say, I've done it. I've already done it. I've done what they've told me to do. Another little thing, and this is off topic, but on topic as well, is viruses. Viruses, or you can think of that as like inflammation, can also create problems where your body is going to prioritize problems that needs to be addressed like right away before being able to conceive. So that's another thing, is any stealth infections or secret viruses or any pathogen that's active. If someone says, I actively have reactivated EBV, right? Or H. pylori, or I guess you can kind of think of pathogens, metal, mercury, toxins, right? Toxic load. Those are in that inflammatory bucket, but that can also be driving up inflammation as well. So you would want to look at that stuff too. So in a nutshell, I hope that this was a little bit helpful. I hope not confusing. Sometimes I know I can be a little chatty, but the point is that if you're someone out there struggling, if you're a husband, if you're a boyfriend, if you're a partner of someone, if you are a woman dealing with these issues, please know that there could be some underlying layers that might need to be worked through, and you can still have some of your goals achieved with fertility. But if you're not looking for the problems, then how do you work through that stuff, right? Like, we can't fix something we don't know about. Well, how do we not know about it? Because it's not being tested, it's not being looked at. Okay, so just wanted to share that little tidbit this morning about fertility hormones and also nutrition. There's a lot of things that happen with nutrition that we could dive into too. I was also talking to a young woman yesterday. We were going through prenatals and the importance of methylated prenatals and the importance of high levels of the right type of folic acid, methylated, and the right type of methylcobalamin B12. Dosage is high. Are you absorbing it? I love to use at least 1 round of liquid sublingual prenatals for some of my women because it bypasses their gut if perhaps they're not absorbing everything fully. Most people absorb some form of it. Very rarely do people say, I'm not absorbing anything. But if there's gut issues, it could affect how you're digesting a vitamin. So we know that prenatal vitamins are super important. High levels of B vitamins. When you look at a prenatal versus a multivitamin, and this is another topic we could talk about, but a prenatal percentage of daily value usually clear 300, 400, 1,000. A regular multivitamin, depending on what vitamins in there, might only be 8% of the daily value, 20% of the daily value, 50%. It's not as much. Pregnant women are considered special populations of people, so they do require more nutrients, which is another topic of what can you do to prepare? Well, a prenatal vitamin's a great way, and you can start that way months in advance. Also making sure that your gut can absorb it. So I don't think I have any behind me, but sometimes I use maybe I do here, liquids because they're easy to absorb. They're ensured to absorb under the tongue. And then you might work on the gut stuff with the patient and then move into maybe some actual capsules. But the amount of women that show me their prenatal vitamin that is not methylated, and they're my doctor never talked with me about methylation issues or MTHFR gene mutations. That's another thing that can also drive infertility is genetic issues with how we methylate. It's kind of wild. It's kind of wild when they say, oh, this is the vitamin I'm taking from CVS. Do not buy your vitamins from CVS or Walgreens. Do not. Even Whole Foods. There are vitamins, and I know it's a hard thing to figure out which brand, what type, what kind, what dosage. I get it. But you do want to make sure it's customized to you. And not all vitamins are complete. Some of them are missing things. Sometimes iron is missing from vitamins. Certain nutrients might be missing. Certain multivitamins might have extra stuff too. Not only all your vitamins, B1, B2, B3, B5, B6, B7, B9, B12, zinc, iron, iodine, selenium, vitamin A, CoQ10, but they also might put in some eye formulas like lutein or zeaxanthin or some liver gallbladder support like choline, which is great. Also, some prenatals have omegas in there, omega-3s, obviously DHA, EPA, really important stuff. So that's another topic we can dive into maybe a different day is what do I need to prepare? It's like building a house. I want to build a house, right? Okay, that's a goal. What do I need? What equipment, right? What stuff do I actually need to create the house? Well, same thing for a baby. And a lot of times, just from someone that looks at biomarkers and blood work often, most people are very deficient. Very, very deficient. I'm talking vitamin C 0.2 in the blood, which is low. I'm talking B12 in the 200 range. The low is 200, the high is 1100. People are very, very low, or they're subclinically low, meaning they're right there. They're in the range, right? You passed your test. 60 to 100 is the grading scale, but you're 62%. Did you really pass your test? I don't know. So we want to look at functionality, bioavailability, dosage, mechanism of dosage, and the right type. Some people can't take iron. They might say, I lean towards being constipated. Iron can sometimes slow the colon down, even though they all say they're not constipating. Most people say, it still constipated me. So some people that might have hemochromatosis or iron overload, it's not cookie cutter. It's never cookie cutter, okay? But don't get your vitamins from Walgreens or CVS or I don't know where people might get stuff like that. Don't do it. Any questions though, guys, while we're on? I have just a couple minutes and then I do have to crop off because I have a patient coming in shortly. But any other questions or questions at all, I should say, about the topic of fertility, female reproductive health, anything like that? I got some really nice feedback from you guys regarding the post that was about blood sugar and pancreas support and supplements that can help blood sugar and all the things. Some woman had mentioned she used inositol. She really loved it, which is a supplement for blood glucose support. Somebody had recommended she did a little bit of chromium. Gymnesium was a popular one. Fenugreek, right? These are all things that can help. Berberine. That was the previous video. So if you're like, what is she talking about? Go back to look at that other video. But it doesn't look like there's questions. I will save this. So if you're jumping on now, you can look at this a little bit later. Check this out. But this is a topic of what else can cause issues with fertility that's maybe not traditional or not standardly looked at. Is standardly a word? I don't think so. Happy Wednesday. It's hump day. It's beautiful out. Our weather is so nice. So nice. So get in the sun. I'll see you guys soon.